ಸಂಪ್ರದ ಆಸ್ಪತ್ರೆನ ನಾವು 4 ವರ್ಷದ ಹಿಂದೆ ಶುರು ಮಾಡಿದ್ವಿ. ಮುಂಚೆ ಇದನ್ನ ರಾಜಲಕ್ಷ್ಮಿ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಇತ್ತು. ಇದನ್ನೇ ಮಾಡಿಫೈ ಮಾಡಿ ಸ್ವಲ್ಪ ಮಾಡರ್ನೈಸ್ ಮಾಡಿ ಸಂಪ್ರದ ಹಾಸ್ಪಿಟಲ್ ಅಂತ ಮಾಡಿದ್ವಿ. ಇವತ್ತಿನ ದಿನ 4ನೇ ವರ್ಷಕ್ಕೆ ನಾವು ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಯೂನಿಟ್ ನ ಶುರು ಮಾಡಿದ್ದೀವಿ. ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಅಂದ್ರೆ ಮಜ್ಜೆ ಕಸಿ ಮಾಡೋದು, ಮಜ್ಜೆನ ಕಸಿ ಮಾಡೋದು ಅಂದ್ರೆ ಬೋನ್ ಮ್ಯಾರೋನ ತೆಗೆದು ಇನ್ನೊಬ್ರು ಕೊಟ್ಬಿಟ್ಟು ಅವ್ರಿಗೆ ಹೈ ಡೋಸ್ ಕೀಮೋಥೆರಪಿ ಕೊಟ್ಟು ಅವ್ರ ಕ್ಯಾನ್ಸರ್ನ ಕ್ಯೂರ್ ಮಾಡೋದು. ಇದಕ್ಕೆ ನಾವು ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಈ ಪ್ರೊಸೀಜರ್ ಬಹಳ ದೊಡ್ಡ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಲ್ಲಿ ಮಾತ್ರ, ಕೆಲವೇ ಸೆಂಟರ್ಸ್ ಅಲ್ಲಿ ಬೆಂಗಳೂರಲ್ಲಿ ಲಭ್ಯ ಇದೆ. ನಾವು ನಮ್ಮಂತ ಸಣ್ಣ ಸೈಜಿನ ಹಾಸ್ಪಿಟ್ಲು ಯಾವುದೂ ಈ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಇದುವರೆಗೂ ಮಾಡಿಲ್ಲ. ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಮಾಡುವಾಗ ಜಾಸ್ತಿ ನಮಗೆ ತೊಂದರೆ ಆಗೋದು ಇನ್ಫೆಕ್ಷನ್ಸ್ ಇಂದ. ನಮ್ಮ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಕಡಿಮೆ ಇರೋದ್ರಿಂದ ನಾವು ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಅಲ್ಲಿ ದೊಡ್ಡ ಆಸ್ಪತ್ರೆಗಳಿಗಿಂತ ಜಾಸ್ತಿ ಸಕ್ಸಸ್ ಬರ್ಬೋದು ಅಂತ ನಮ್ಮ ಊಹೆ. ಸೊ ಇದನ್ನು ಮಾಡಿದ್ದೀವಿ. 3 ರೂಮ್ಗಳು ಮಾಡಿದ್ದೀವಿ. ಸ್ವಲ್ಪ ಕಡಿಮೆ ಬೆಲೆಯಲ್ಲಿ ಬೇರೆ ಕಡೆ ಅಫೋರ್ಡೆಬಿಲಿಟಿ ಇಲ್ಲದೆ ಇರೋ ಪೇಷಂಟ್ಸ್ಗಳಿಗೂ ನಾವು ಇಲ್ಲಿ ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಮಾಡಿ ಇದೊಂದು ರೀತಿಯ ಸೋಷಿಯಲ್ ಸರ್ವಿಸು ಆಗುತ್ತೆ ಅಂತ ನಮಗೆ ಭಾವನೆ ಇದೆ.
I am Sammprada and I am the Managing Director of Sammprada Hospital. It's a pleasure today to inaugurate this BMT unit, and BMT unit does exist in a lot of multi-speciality hospitals or larger corporates, but for a smaller hospital like ours to have a BMT unit is indeed a proud moment for us today. And I would like to thank our entire team and people who have worked behind the scenes to make it happen today, and we are hoping to provide the public cancer cure much affordable cost and also ensure that it reaches to most of the crowd. Thank you.
Sammprada Hospital ಅವರು ಒಂದು ಬೋನ್ ಮ್ಯಾರೋ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ ಯೂನಿಟ್ನ ಇವತ್ತು ಇನಾಗ್ರೇಟ್ ಮಾಡಿದ್ದಾರೆ. ಇದು ಸಮಾಜಕ್ಕೆ ಹಾಗೂ ಕ್ಯಾನ್ಸರ್ ಮತ್ತು ಇತರ ರೋಗಿಗಳಿಗೆ ಒಳ್ಳೆಯ ಒಂದು ಸಾಂತ್ವನ ಹಾಗೂ ರೋಗದ ಮೇಲೆ ಜಯ ಕೊಡಲಿ ಅಂತ ನಾನು ಹಾರೈಸ್ತಾ ನನ್ನ 2 ಮಾತುಗಳನ್ನ ಮುಗಿಸ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು.
ಶೋಭಾ ಟ್ರಸ್ಟ್ ಎಂಬುದು 2022 ಸ್ಟಾರ್ಟ್ ಆಯಿತು. ಡಾಕ್ಟರ್ ರಾಧೇಶ್ಯಾಮ್ ಬಂದು ತುಂಬ ವೆಲ್ ನೋನ್ ಮೆಡಿಕಲ್ ಆಂಕಾಲಜಿಸ್ಟ್. ಅವರು ಮೋರ್ ದೆನ್ 2 decades ಅವರ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಇದೆ. ತುಂಬ ಸರ್ವಿಸ್ ಮಾಡಿದ್ದಾರೆ. ಬಟ್ ಏನಾಗ್ತಿದೆ, ಒಂದು ಪರ್ಸ್ನಲ್ ಟ್ರಾಜಿಡಿ. ಅವರು ಅದರಲ್ಲಿ ಅವ್ರ ಅಮ್ಮನಿಗೆ ಬಂದು ಓವೇರಿಯನ್ ಕ್ಯಾನ್ಸರ್ ಬಂತು, ಅವ್ರ ಅಪ್ಪನಿಗೆ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ ಬಂತು, ಅವರು ಅದರಲ್ಲಿ ಎಲ್ಲ ತೀರೋದ್ರು. ಎಷ್ಟೋ ಜನ ಈ ಥರ ಆಗುತ್ತೆ. ಇವ್ರು ಏನು ಮಾಡಿದ್ರನ್ನ ಇದು ಬಂದು ಪ್ರಿವೆಂಟಿವ್ ಆಂಕಾಲಜಿ ಇಸ್ ಎ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್. ಯಾಕೆಂದ್ರೆ ಹಿ ಹಸ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ಡ್ ಎಷ್ಟು ಕಷ್ಟ ಆಗುತ್ತೆ ಒಂದು ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ ಟ್ರೀಟ್ ಮಾಡೋದು, ಎಷ್ಟು ಕಷ್ಟ ಆಗುತ್ತೆ, ಒಂದು ಸಾಧಾರಣ ಜನಕ್ಕೆ ಎಷ್ಟು ಕಷ್ಟ ಆಗ್ತದೆ ಎಂಬುದನ್ನು ಅವರು ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಮಾಡಿ ಹಿ ವಾಂಟೆಡ್ ಟು ಡೂ ದಿಸ್ ಶೋಭಾ ಟ್ರಸ್ಟ್ ಅಂತೇಳಿ ಪ್ರಿವೆಂಟಿವ್ ಆಂಕಾಲಜಿ ಸ್ಪೇಸ್ಲಿ ಕೆಲಸ ಮಾಡಬೇಕೆಂಬುದು. ಸೊ ಈ ಶೋಭಾ ಟ್ರಸ್ಟ್ ಏನು ಮಾಡೋಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದನ್ನು, ಇದು ಕ್ಯಾನ್ಸರ್ ವಾರಿಯರ್ಸ್ ಅಂತ ಹೇಳ್ತು ಒவ்வೊಂದು ವಿಲೇಜ್ಲಿನೋ ಒಂದೊಂದು ಚಿಕ್ಕ ವಿಲೇಜಸ್ಲಿನೋ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಕರೆಕ್ಟಾದ ನಾಲೆಡ್ಜ್ ಜನಕ್ಕೆ ಹೋಗಿ ಸೇರಬೇಕು. ಅದು ಹೋಗಿ ಸೇರಿನ ಏನಾಗುತ್ತೆ, ಕ್ಯಾನ್ಸರ್ನ ಅರ್ಲಿ ಹಂಗೆ ಕಂಡುಹಿಡಿದು ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು. ಪ್ರಿವೆನ್ಷನ್ ಮಾಡಿನ ನಮ್ಮ ಫೈನಾನ್ಷಿಯಲ್ ಬರ್ಡನ್ ಟು ದ ಸೊಸೈಟಿ ಕಡಿಮೆ ಆಗಿಬಿಡುತ್ತೆ. ಟ್ರೀಟ್ಮೆಂಟ್ ಈಸಿಯಾಗಿ ಆಗುತ್ತೆ ಅರ್ಲಿ ಸ್ಟೇಜಲ್ಲಿ. ಈಗ ಒಂದು ಚಿಕ್ಕ ಪ್ಲಾಂಟ್ ಇದೆ ಅಂತ ಇಟ್ಕೊಳ್ಳಿ, ಒಂದು ದೊಡ್ಡ ಮರ ಇದೆ. ಇಟ್ ಈಸ್ ಈಸಿ ಟು ರಿಮೂವ್ ಅ ಸ್ಮಾಲ್ ಪ್ಲಾಂಟ್ ರಾದರ್ ದ್ಯಾನ್ ಎ ಟ್ರೀ. ಕ್ಯಾನ್ಸರ್ ಅದೇ ಥರ. ಕ್ಯಾನ್ಸರ್ ಬಂದು ಒಂದು ಚಿಕ್ಕ ಮೈಕ್ರೋದಂಗೆ ಬಂದಾಗ ಟು ಬಿಕಮ್ ಎ ಸ್ಮಾಲ್ ಬಾಲ್ ಇಟ್ ಟೇಕ್ಸ್ ಮೆನಿ ಇಯರ್ಸ್. ಫ್ರಮ್ ದಿಸ್ ಟೈಮ್ ಟು ಈ ಸ್ಟೇಜ್ಲಿದ್ದು ದೊಡ್ಡದಾಗಕ್ಕೆ ವಿತಿನ್ 6 monthsಲಿ ಅದು 4th ಸ್ಟೇಜ್ ಹೋಗಿಬಿಡುತ್ತೆ. ಸೊ ಪ್ರಿವೆಂಟಿವ್ ಆಂಕಾಲಜಿ ಫೋಕಸ್ ಮಾಡಿನ ಒಂದು ಪೇಷಂಟ್ಸ್ಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ, ಇನ್ನೊಂದು ಸೊಸೈಟಿ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಸೊ ಇದು ಬಂದು ನಾವು ಇಲ್ಲಿ ಸಿಟೀಸ್ಲಿ ಎಲ್ಲ ಮಾತಾಡಿ ಒಂದು ಪ್ರಯೋಜನ ಇಲ್ಲ. ಒಂದೊಂದು ಹಳ್ಳಿಲಿನೂ ಹೋಗಿ ಪ್ರಿವೆಂಟಿವ್ ಆಂಕಾಲಜಿನ ಕೊಂಡ್ಬರಬೇಕು ಎಂಬುದು ಡಾಕ್ಟರ್ ಶೋಭಾ ಟ್ರಸ್ಟು ಹೆಡ್ ಡಾಕ್ಟರ್ ರಾಧೇಶ್ಯಾಮ್ ಅಂಡ್ ಸುಮಾ ರಾಧೇಶ್ಯಾಮ್ ಅವ್ರ ಡ್ರೀಮು. ಸೊ ನಾನು ಅವ್ರು ಕೂಡ ಕೈ ಜೋಡಿಸಿದ್ದೀನಿ ಆಸ್ ಡೈರೆಕ್ಟರ್ ಆಫ್ ಶೋಭಾ ಟ್ರಸ್ಟ್. ಸೊ ದ್ಯಾಟ್ ವಿ ಟೇಕ್ ಅಪ್ ದಿಸ್ ಮೆಸೇಜ್. ಇದು ನಾವು ಬೇಕಾದ್ರೆ ಮಾಡೋಕ್ಕಾಗಿಲ್ಲ. ಇದಕ್ಕೆ ಬಂದು ಸೊಸೈಟಿ, ಸಿವಿಲ್ ಸೊಸೈಟಿಲಿರೋ ಎಲ್ಲರನ್ನೇನು ಕೈ ಜೋಡಿಸ್ಬೇಕು. ಪಬ್ಲಿಕ್ ಆಗಲಿ, ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್ ಆಗಲಿ, ಎಜುಕೇಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಗಲಿ, ಕಾರ್ಪೊರೇಟ್ಸ್ ಆಗಲಿ, ಪೊಲಿಟಿಷಿಯನ್ಸ್ ಆಗಲಿ, ಅಡ್ಮಿನಿಸ್ಟ್ರೇಟ್ ಆಗಲಿ, ಎಲ್ಲರನ್ನೇ ಕೈ ಜೋಡಿಸಿನತ ಇದು ಆಗುತ್ತೆ. ಪ್ರಿವೆನ್ಷನ್ ಇಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್. ಅವರ್ ರಿಕ್ವೆಸ್ಟ್ ಫ್ರಮ್ ಶೋಭಾ ಟ್ರಸ್ಟ್ ಇಸ್ ಈಚ್ ಒನ್ ಆಫ್ ಯು ಪ್ಲೀಸ್ ಗೆಟ್ ಅಸೋಸಿಯೇಟೆಡ್ ಇನ್ ಸಮ್ ಫಾರ್ಮ್ ಆರ್ ದಿ ಅದರ್ and help us to reach to the last person in the chain, that is the underprivileged person, so that they lead a healthy life and happy life. ಸೊ ಇದು ಬಂದು ನಮ್ಮ ರಿಕ್ವೆಸ್ಟ್ ಶೋಭಾ ಟ್ರಸ್ಟ್ದು. ಸೊ ನಮಗೆ ಎಲ್ಲ ನೀವು ಫಾಲೋ ಮಾಡಿ, ನಮ್ಮ ಆ್ಯಕ್ಟಿವಿಟೀಸ್ನೆಲ್ಲ ಫಾಲೋ ಮಾಡಿ, ಸಪೋರ್ಟ್ ಮಾಡಿ, ಎನ್ಕರೇಜ್ ಮಾಡಿ. then let us work together for this in the preventive oncology space. Thank you so much.
ನಮಸ್ಕಾರ. ಇವತ್ತು ತುಂಬ ಸಂತೋಷ ಆಗ್ತಾ ಇದೆ, ಯಾಕಂದರೆ ನಮ್ಮಂಥ ಚಿಕ್ಕ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ನಾವು BMT ಯೂನಿಟನ್ನು ಇನಾಗ್ರೇಟ್ ಮಾಡಿದ್ದೇವೆ. ಈ BMT ಯೂನಿಟ್ಗೆ ತುಂಬ ಎಕ್ಸ್ಪರ್ಟೀಸ್ ಬೇಕು. ಅಫ್ಕೋರ್ಸ್ ಡಾಕ್ಟರ್ ರಾಧೇಶ್ಯಾಮ್ ಇದ್ದಾರೆ ನಮ್ಮಲ್ಲಿ. ಸುಮಾರು 30 ವರ್ಷದಿಂದ 500+ BMT ಮಾಡಿದವರು ಇದ್ದಾರೆ. ಸೊ ಅವ್ರ ಬೆಂಬಲದಿಂದ ನಾವು ಈ ಯೂನಿಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದೀವಿ. ಇಂಥ ಚಿಕ್ಕ ಹಾಸ್ಪಿಟಲಲ್ಲಿ ಈ ಥರ ಒಂದು ಎಕ್ಸ್ಪರ್ಟ್ ಯೂನಿಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿರೋದು ತುಂಬ ಸಂತೋಷದ ವಿಷಯ ನಮಗೆ. ಸೊ ನಮ್ಮ ಸ್ಟಾಫ್ ಮತ್ತು ಎಂಟೈರ್ ಸಂಪ್ರದ ಫ್ಯಾಮಿಲಿಯ ಬೆಂಬಲದಿಂದ ಇದನ್ನು ಶುರು ಮಾಡಿದ್ದೇವೆ. ಸೊ ಇದರಿಂದ ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳಿಗೆ ತುಂಬ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ ಅಂತ ನಾವು ಆಶಿಸ್ತೇವೆ. ಅಟ್ ಅನ್ ಅಫೋರ್ಡಬಲ್ ಕಾಸ್ಟಲ್ಲಿ ಎಲ್ಲರಿಗೂ ತಲುಪೋ ಥರ ಮಾಡಬೇಕು ಅಂತ ವಿ ಲುಕ್ ಫಾರ್ವರ್ಡ್. BPL ಕಾರ್ಡು ನಾವು ಗೌರ್ಮೆಂಟ್ ಅವ್ರ ಜೊತೆ ಮಾತಾಡಿ ಆಯುಷ್ಮಾನ್ ಭಾರತ್ ಮತ್ತು ಯಶಸ್ವಿನಿ ಸ್ಕೀಮ್ಸ್ ತರಕ್ಕೆ ನೋಡ್ತಿದ್ದೇವೆ. ಪ್ಲಸ್ ಬೇರೆ ಥರದಲ್ಲಿ NGO ಟೈಅಪ್ಸು, ಕ್ರೌಡ್ ಫಂಡಿಂಗು ಎಲ್ಲ ಮಾಡಿ ನಾವು ಆದಷ್ಟು ಪೇಷಂಟ್ಗೆ ಕಡಿಮೆ ದರದಲ್ಲಿ ಮಾಡಿಸೋ ಥರ ನೋಡ್ತಿದ್ದೇವೆ. ನಮ್ಮದೇ ಆದ ಒಂದು ಟ್ರಸ್ಟು ಇದೆ. ಸೊ ಅದ್ರ ಮೂಲಕನೂ ನಾವು ಫಂಡ್ ರೈಸ್ ಮಾಡಿಬಿಟ್ಟು ಪೇಷಂಟ್ಸ್ಗೆ ಕೊಡೋ ಉದ್ದೇಶ ಇದೆ. 4-5 NGOs ಜೊತೆ ಟೈಅಪ್ ಇದೆ. ನಮ್ಮದೇ ಟ್ರಸ್ಟ್ ಇದೆ. ನಾವು ಪ್ರಿವೆಂಟಿವ್ ಕ್ಯಾಂಪ್ಸು ಮಾಡ್ತೀವಿ, ಅದರಲ್ಲಿ ಫಂಡ್ ರೈಸಿಂಗು ಮಾಡ್ತೀವಿ. ಸೊ ಕ್ಯಾನ್ಸರ್ ರೋಗಿಗಳಿಗೆ ಮತ್ತು BMTಗೆ ಬರೋ ರೋಗಿಗಳಿಗೆ ಬೆನಿಫಿಟ್ ಆಗೋ ಥರ ಮಾಡಬೇಕು ಅಂತ ನೋಡ್ತಿದ್ದೀವಿ. ಶೋಭಾ ಟ್ರಸ್ಟ್.
Good morning everyone. My heartfelt thanks for all of you for attending this meeting. This is a very important, auspicious day for us because I classify all the hospitals into two categories. One is large hospital and another is small hospital. That's how patients look at us. And all of us know that the small hospitals are in people's mind associated with unclean hospital, less staffed hospital and less expensive hospital. And it will not have facilities for major surgeries, major therapies like bone marrow transplantation. So that is what people think about small hospitals. So ours is a small hospital. So since I have an experience of working in large multi-speciality hospitals, large cancer hospitals and small cancer hospitals like ours, I have some conclusions to draw about the comparison between large and small hospitals. So we have listed out some of the advantages of small hospitals. So to take the specific example of our hospital, Sammprada Hospital, we are situated in a very unique location. Lot of greenery around us, thanks to Dr. Janardhan, who is the owner of the hospital and encouraged us to take over this hospital and improvise and continuously supporting us in all our endeavors. So this hospital is situated in a very good place, and all the patients who have come and got admitted in our hospital say that this is better than any other hospital as far as the location is concerned. The second USP of our hospital, I think all of you must have experienced, is the cleanliness. So we try to make this hospital spotlessly clean, and all our patient reviews tell us that we have succeeded to a large extent in that endeavor. The third important thing what we have in our hospital is individualized care. So each patient is treated like our own, and we focus on to the needs of the patient. So our needs, our convenience takes backseat, and patient becomes all important. As we were taught in medical school, patient should be the center of your universe, and we truly make the patient as our center of our universe. Especially when there is a cancer patient, it is both physical, emotional well-being. We try to financially help them. Have some issues, we try to advise them, and we have a special USP, acquired infection. Now, why did we start bone marrow transplantation in our hospital? And the is one of the lowest. Even when there is an infection, the routine antibiotics are sufficient to control the infection in our hospital. Since our overheads are not very large, our non-oncological is the lowest possible for the size of our hospital. Bone marrow transplantation more successful in this setup. Definitely we cannot succeed without support from other consultants, other doctors, especially the oncologists and hematologists. Dr. Niti is a well-known oncologist, medical oncologist. We have been colleagues for many years now. And Dr. Ganesh, who is an oncologist, medical oncologist, happens to my member. Need support from doctors like that to succeed. And also, Dr. Fanindra is our orthopedician. They can help us by referring multiple myelomas and leukemias for bone marrow transplantation. So, surgeons can refer as patients. I have seen one patient. We don't separate out alternate medicines. We don't say that Ayurveda is useless, homeopathy is not useful. So we welcome all the specialities. We feel that there is merit in each speciality, and if there is any lacuna in allopathic medicine, Dr. Lalit, who is our Ayurvedic specialist, he is very much interested in cancer therapy with Ayurveda and alternate medicine. He has been a great strength of support for our hospital. I thank him for that reason. Dr. Ravindra, who is a physician and diabetologist, and others. One of the things which almost no hospital has done, and very urgent, is a very important thing, and people who are cured of cancer have high risk of developing a second cancer. Advice about prevention and early diagnosis, and we have a department of preventive oncology, and Dr. Vinod Ramani, he is our preventive oncologist.
Today marks a significant milestone in our mission, advanced treatment and renewed hope to patients battling with, to introduce a true visionary in oncology and the driving force behind Sammprada Hospital, Dr. Radhesham Nayak. Dr. Nayak is Karnataka's first bone marrow transplant and the first intra-artillery chemotherapy in Karnataka, trained at world-renowned institutions including MD, Anderson Cancer Institution, USA, to say a few words. Sir.
Background of this hospital. She was the Dean of Bangluru Medical College, Professor of Head of the Department of Obstetrics and Gynecology. 1 month before that, she started this hospital. I was sent out of the class, really. And my first sister is a gynecologist, second sister is a pediatrician, third sister is a pediatrician, first brother-in-law is an anesthetist. One niece is, we have operated in this hospital. Okay, my sister incidentally appeared for it. That was the integrity those days. So I finished in 79. They both were taking care of the hospital, sister and mother. And I was, after finishing my post-graduation, everything, I was told not to come here for about 10 years. So I was working in St. John's, St. Martha's, Sindhi Hospital, Lakeside. Wherever I could get a job, I used to go in search of it. Because those days unemployment was a big thing. And then 92 June, my father passed away. That day my mother told me, in those days was, this hospital, Rajalakshmi Hospital, was known for maternity and child care. Nothing else. 3 months or one breast lump once in 3 months. That was the incidence of other cases. Changed the perception of this hospital to the public. Hard days, anyway, went on well. 60 I wanted to retire. Somehow I thought people are taking care of the government. So I thought, why should I work? Put my hard work, everything, give it there. And in return what we get? Increase in tax. I mean, there are two types of people, why and why not. So I was having a talk with Dr. Radhesham, why don't you take over? He has been with me for now 20 years. 20 years he's with me. So he was in Delhi dining, sir, management, headache, that will be there. That is why I'm coming out. So corruption. Every year we have to pay 5 or 6 departments corruption. Honestly, even today. Maybe more now. So why you should work? My food, spend my sleepless nights, all those things for. All these dirty things. I don't need that anymore. I have many other things to do. There are two types of people, why and why not. I belong to why, Radhesham belong to why not. So I said, why not? So this is how we took over, and it's now 4 years. This December will be 4 years. And I am so happy it's growing into this thing with a different perception from maternity care to general hospital, orthopedics to oncology hospital. It's a good journey, Dr. Radhesham. I thank you.
And next, it's my absolute, with over 2 decades of experience, she has been at the forefront of evidence-based care, immunotherapy, and personalized medicine in India. A passionate Dr. Raizada has touched countless lives through her experience and dedication. Dr. Niti.
Of you today. It's actually a pleasure and an extreme honor to be here today, especially when Dr. Radhesham is coming up, which includes my honorable seniors who have guided me through this path. Today marks a very special milestone, the launch of this Bone Marrow Transplant Center. And this is just not another addition of a healthcare infrastructure, but actually bridges a very critical gap. And this gap has been in our city in hematology and oncology space, although we serve a lot of quaternary care hospital. But as Dr. Radhesham rightly said, it's in the heart of the city, and this is the need of our Bone Marrow Transplant Center. I have actually known Dr. Radhesham right from the inception when I came to Bangalore. 2 decades of my association with her. 18 years back, actually, Dr. Radhesham was the first oncologist whom I met when I came to Bangalore. I went to Curie Center. I don't know whether sir remembers it. And I said, sir, I'm kind of interested in joining over. And he said he'll let me know. But I think just 2 days later, I joined HCG. So that was my journey in Bangalore as an oncologist. And from there in HCG to Fortis, and of course now here. Over years, we have seen his dedication, his compassion, and of course his excellent clinical care, and his deep commitment to building strong patient-centric institutions, which this being one of them. Here, but there's a new dimension as well. We have Shobha Trust, which is a testament of his vision, a blend of compassion, competence, and of course collaboration. Bone marrow transplant touches lives in many ways. We have seen children getting reformed because of bone marrow transplant. A disease which still requires a lot of work, especially because of the disparity which exists in our country. It has been life-changing for thalassemia and sickle cell cases. Of course, in adults and leukemia, lymphomas and myeloma, it has been a transforming journey. And this is what this institute brings, right at where we deserve, in the heart of city, very in proximity to where everything, and of course with patient-centric care and excellent clinical settings. So congratulations to the entire management who have come up with such a brilliant plan and a brilliant position. And of course with the support, probably very economically viable as well. I wish you all the best, sir. And I wish Suma ma'am to kind of bring it to next dimension, this center. A very hearty congratulations.
He's a senior medical oncologist and HOD at St. John's Hospital, Bangalore. With over 2 decades of experience and training from Kidwa Institute, Dr. Ganesh specializes in lung, breast and colon cancers, as is widely respected for his research-driven approach in cancer care. And therefore may I request Dr. Ganesh to say a few words. Dr. Ganesh?
Actually, there is nothing that I can add to whatever my seniors and pioneers in medical oncology and hematology have already told. So I would just like to congratulate Dr. Radhesham and Sammprada family for this noble endeavor. I am sure this would help all the deserving patients in Bangalore and across India. Thank you very much.
My level. Ladies and gentlemen, it is my privilege to introduce not just a specialist but a friend. He is a wing commander, at least an anesthesiologist by training and an alumnus of IIM Lucknow. Dr. Naga has held leadership roles at Narayana Health, HCG Cancer Hospital and of course Fortis Hospital. Beyond his professional achievement, he has been deeply committed to social causes through the Vonisha Service Foundation, empowering underprivileged women and children in education, health and sports. Dr. Naga joins the Sammprada family as director of the Shobha Trust, carrying forward the mission of extending Sammprada's spirit of care beyond the hospital. And therefore, with a lot of love and respect, I request Wing Commander Dr. Naga to take the stage.
Good afternoon, everybody. Thank you, Tony, for the warm introduction. Dignitaries on the dais, off the dais, my dear friends. When someone goes through a personal tragedy and suffering, they generally become filled with remorse, negativity and hate, further complicating their lives and lives of people around them. But there are a very few who see tragedy as a path to finding life's purpose, where tears can bring focus. Such people often develop a deep compassion and understanding of life. Compassion is a commitment rather than an inherent trait. True compassion often requires going beyond simple gestures to address the root cause of suffering. Dr. Radhesyam, a renowned oncologist is in the country, who has been academically brilliant and passionate about his clinical work and research work, is one such person who committed himself to extend his compassion to the needy. We appreciate this effort, sir, for this, the big round of applause. It's a sad thing that his mother succumbed to ovarian cancer, father to lung cancer. When this happened, he felt a deep conviction that prevention is more powerful than cure. With that overpowering thoughts, with support from his better off, Mrs. Suma, he established Shobha Trust in 2022 to help inspire the women and youth in the rural and semi-urban areas across Karnataka and other parts of the country to become change agents for their communities and families. The trust focuses on youth and women, empowering young people to spread awareness, ensuring that rural women and education. Dr. Nayak's mission is to reach even the most remotest parts of the. You will be knowing that there are a lot of disparities in cancer screening services because they are multifactorial. It includes an interplay and genetic constitution, environmental exposure and availability of health resources. Where we seek to unite for health and ignite hope. One per village who will be trained about spreading the correct knowledge to assist in identifying the cancer risk early. Cervix, stomach and colorectal region, first degree relatives of cancer ASHA workers, community health worker from the government health centers. So our dedicated team will implement with informed consent and privacy. We intend to increase the existing Nutrition and Nutrition Committee, Mahila Mandal, self-help groups, etc., which foster adherence to testing to the follow-up regimen. The opinion of influential community stakeholders will enable participatory research of the facilitators. All these efforts will not only help the patients to diagnose the preventable cancers are identified in the early budding stages and necessary steps like focused nutrition, preventive cancer screening program, rather than adhering only to a clinic-based programs, so that we can reach the underprivileged population in appropriate time. Taken up by the experts.
For all the patients that will get treated here, congratulations, sir. And I want to convey my sincere thanks to all the dignitaries on the dais. Dr. Neeti had to leave, but her presence meant a lot to us today. And Dr. Naga, who graced this occasion with his presence. And of course, Dr. Ganesh, who's here to help us through with to you. Thanks to all the staff who work at Sammprada Hospital for making this event a grand success. And all the supportive staff. Last but not the least, Mrs. Suma, who's the Managing Director of our Sammprada Hospital, whose conviction has wished this dream a great success. Thanks one and all.
Well, thank you, Dr. Subha.
ಅಂತ ಪೋಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಇದ್ದೆ. ಅವಾಗ ಏನು ಮಾಡೋದಂತ ನನಗೆ ಗೊತ್ತಿಲ್ಲ. ನನಗೆ 2 ಚಿಕ್ಕ ಮಕ್ಕಳು ಇದ್ದಾರೆ. ಮತ್ತು ನಮ್ಮ ಹಸ್ಬೆಂಡು ಲ್ಯಾಬ್ ಅಸಿಸ್ಟೆಂಟ್ ಆಗಿ ಒಂದು ಸ್ಕೂಲಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಾಯಿದ್ದಾರೆ. ಇವಾಗ ನಾನು ಕ್ಯಾನ್ಸರಲ್ಲಿಂದ ಕ್ಯೂರ್ ಆಗಿ ಇವಾಗ ನಿಮ್ಮ ಮುಂದೆ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ. ನಾನು ಇವತ್ತು ನಿಮ್ಮ ಬದುಕಿದ್ದೀನಿ ಅಂದರೆ ಶೋಭಾ ಟ್ರಸ್ಟ್ ಅಂತಾನು ಮತ್ತು ರಾಧೇಶ್ಯಾಮ್ ಸರ್, ಸುಮಾ ಮ್ಯಾಮ್ ಅಂತಾನು ಇವತ್ತು ನಿಮ್ಮ ಮುಂದೆ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ.
knowledge